Now, some of you have had surgery in here. Anybody in here has had some kind of surgery, maybe like tooth out or something, right? Most of us have had something like that. Now, that's not fun, right? Surgery's not fun. Nobody likes it. We're always a little nervous. And what if the doctor came in and he comes in, the doctor always comes in first, right? Before he wheels you back. What if the doctor came in and he said, I've been doing this a really long time, and I have to be honest, I'm getting a little bored with doing it the same way all the time. And I was thinking that I was hoping you'd help me out. I was hoping that I could really kind of jazz it up a little bit. And I was hoping that maybe with you, just let me try this out on you. Maybe I could do it blindfolded. Would that be okay? Really? Because this is the land of no worries, right? Would that make you worried? Yeah? All right, well. You see, that's how abortions are done every day in our abortion clinic. They might as well have a blindfold on. Because they can't see what's happening inside that woman's uterus. They can't see a thing. They have an instrument called a cannula. They take this cannula and they insert it into the woman's uterus, and when they think they feel some tension, they stop. They just think, this must be the top of the woman's uterus, so I'm going to stop. And they move it over a little to the right, to the left. They make a pass or two. And then that's it. The abortion only takes about 5 minutes. It's over pretty quickly. What happens if they don't feel that tension at just the right moment and they push too far? Well, what happens if you have a garbage bag and you poke a box or something too hard through it? Pokes a hole, right? Well, the same thing happens with uterus. It'll just poke a hole right through it. It's called a uterine perforation. It happens all the time. There are women that have laid on these abortion tables. Uterine perforation has happened, and the doctors just keep packing her full of gauze, hoping that the bleeding will stop. And sometimes it doesn't stop, and sometimes the women die right there on the table because the abortion clinic is terrified to call an ambulance. The scariest thing for an abortion clinic is to have an ambulance zoom in their parking lot with screeching sirens and flashing lights. Oh, it's terrible PR. It's the worst PR for an abortion clinic. They'd rather have a woman die and try to quietly cover that up than have an ambulance pull in their parking lot. That's really happened. I met a woman one time back in the U.S. She was 21 when she had her abortion. They perforated her uterus. They didn't tell her. She went home. They sent her home with some antibiotics. They said, the bleeding will stop eventually. You'll be fine. A few weeks later, she had to go to the hospital. She'd spiked a high fever. She was feeling terrible. She didn't know what was going on. And she went to the hospital, and she found out that her reproductive organs had developed gangrene. She had to have a hysterectomy at 21 years old. I mean, this is not uncommon. This stuff really happens. People really die from abortion. People really lose their fertility from abortion. People really get injured after they have an abortion. It really does happen. I've seen it. It happened at my clinic. It happened with patients that I saw. It really does happen.